My name is Heather Merriman. I am with the Insurance Ninjas, and I am going to give you a quick tour around the site New York State of Health. If you live in New York or file your federal taxes from the state of New York, outside of employer coverage, you are very much limited to only the plans that are available on New York State of Health. So as you can see here, where you would go is New York, NY, State of Health, ny.gov. I will also have that email address in the description box below. This is currently what the website is looking like, and we are going to be taking a quick tour and using an example of looking for coverage for next year. So the first thing that we want to do is actually click Get an Estimate, because first we want to do a little bit of window shopping. So what we are looking at here, you're going to first plug in your zip code. So let's say you happen to be in zip 10541. Next, you are then going to click Get Started. And now it's going to ask us to confirm our county. So let's go ahead and say we're in Putnam County. However, if you need to, you can hit the drop box down here and choose the correct county that you do reside in. Next up, they are asking how many adults age 20 or older are in the household, including yourself. Note, they are not saying how many need insurance, but how many are in your household. Let's keep things simple, and let's say we're just looking up for a plan for someone who is single and lives individually within their household. Now here we're going to see this next question is how many adults, again age 20 or older, need coverage? Now that's different than the last question. So now let's say that same one person does need coverage as well. Now the next question is how many children, 19 or younger, are in the household? However many kiddos are under your roof, you would add right there. To keep this example simple, let's just say 0. So next, question, are there dependents per your federal tax return that are age 26 to 29 applying for coverage? This would typically be perhaps a disabled child. In this scenario, again, let's keep things simple and let's say no. Now, the next question is in regards to income. Now, the reason why they ask this question is you may be eligible for pricing discounts based on your family size and your gross income. Now, when we're talking about gross income, we're talking about the upcoming year, in this case, 2026. So you are guessing or projecting what your approximate gross income, this is going to be what will go on line 11 on your federal tax return for your modified adjusted gross income. Now, here's the kicker though. If you work for an employer that offers insurance and for whatever reason you don't want to use that insurance, you are not allowed to take a discount on your rates. In this case, let's say that this individual has an approximate gross income of $100,000. Now we're already into the month of December and we are looking for plans for next year. So we're going to leave this box ticked to 2026. But if we were earlier than December and we wanted to look at plans for the rest of this year, we might also choose 2025. So next, we're going to simply click this yellow Next button. Now, here, again, we're going to double check the county to make sure we've got the correct county listed. And now we want to look at who is going to be covered. Our options are a parent and child, a married couple, just an individual, an entire family, or child only. Now, this one, we only have one person in the household, so obviously we're going to be looking at just an individual plan. Next up, Our question, we're confirming again that we do want to look at the year 2026. Now you see here, there's an advanced search. So if we tick that here, we can also sort and filter the options that are about to come up to us next by different ways. Perhaps we want to only look at ones with 5 stars. Maybe we only want to see plans that include family dental or only medical. Maybe we want to filter and only look at the bronze plans. We can go through any of these as well, standard, non-standard. Do we want to look at options outside of the network or inside? I'm not going to check any of these just so that we have the opportunity to be able to look at all of the options ourselves. And now I'm going to click the yellow Show Results button. So here you see in this zip code, there are a total of 42 different options available, okay? And the sort right now, what we are seeing is from the lowest monthly premium to the highest. Now, if we wanted to, we could switch it to show the highest to the lowest. Most people, though, I do believe, want to look at it from the lowest price to the highest. Now, if we scroll down here, we're going to see this is the cheapest or most affordable plan this year for 2026 for this particular individual in this zip code. So that is $598. And we do notice that it is a bronze plan. And there's going to be some additional information that we can also compare. But let's go ahead and tag a couple of these that we want to look at a little bit closer. So let's say we're going to go ahead and click Add to Compare. All right. Now, next up, let's say we want to look at a different carrier. These two are both AM better. Let's say maybe we want to take a look at MVP, see what they're offering for their cheapest plan, which actually does go up quite a bit right there. So let's add that to the Compare button. And now you see we've got a little new yellow button that says Compare Two Plans. Let's go ahead and add one more plan to this as well. In this case, let's go ahead and just choose another different carrier, and we'll choose Anthem. Now let's go ahead and click Compare, and we're going to see a lot of different, very important information that we can compare side by side with this method. So here you see each of the 3 carriers that we chose at the top. These all happen to be bronze plans, as you see here. This light blue line is showing you the monthly cost for each of them. Now, this row here is going to show us the deductible for each of these plans. So we're noticing that the first difference right away is this Anthem plan does have a lower deductible than the other 2 options. Now, the other important factor is going to be the max out of pocket. Now, the max out of pocket is what acts like the ceiling for your financial exposure. Whatever your max is, that's going to be your worst case financial scenario for that year, should you have any type of an, oh my God, type of a situation. Now, here is an interesting line that can be important to some people. Do you need referrals to see a specialist? And we're noticing only on this one with Anthem, do you need a referral? Okay. Next up are going to be the star ratings, which may or may not be relevant. If you think about it, when was the last time you gave a review of your experience with health insurance? So not a lot of people, actually do that. Now here we're going to see a lot of different drop downs for various other services that you could possibly be using. For example, emergency services. Now, this is very interesting to note. Anywhere that you see a benefit that says specifically after deductible, that means you have to meet that plan's deductible and pay full price until you meet that deductible. And then in this scenario, after you meet your deductible, insurance would pay 50% until you met that max out of pocket. Now, what's different with this middle option, you're going to notice there is a copay, but again, those dreaded words, after deductible. That's kind of important for you to look at. Now, some of the other important criteria, we might be looking at other services where a lot of people really like to do telemedicine. So we see that right there as well. Another big one, under outpatient services. If you look here, some pretty important information. Like, for example, what if you just need to see a primary doctor? That's going to be this row right here. And again, all of these plans are forcing us to meet the deductible. Okay. Now, if we want to, we can always go back to the results and we could potentially look for a plan that also offers co-pays without meeting the deductible. You'll see here, remember there were 40 some plans. We could always load some more here as well to see some more options to give us a little bit more choices as well. Now, let's say that you found a plan that you really like. Let's say for whatever reason you decided you just wanted this cheapest plan. Let's say for example, you could click right here. It's going to take you to all those same details that we really saw on the compare button, and you'll be able to choose that plan. You can also, what's really important, and I want to point out to you, you kind of saw this down here, you can get help. If you want to just do some text chatting, you can do that with this button right here. There's an 800 phone number that you can get someone to help you to enroll in the plan of your choice, as well as go in person. I hope this is giving you some insight into the options you do have available. Again, in the state of New York, you are unfortunately slightly limited in that you can only choose plans from New York State of Health. Please find my calendar link in the description box below, along with the website to New York State of Health. And if I can help any further, please feel free to book an appointment at your convenience.